y'all, it's me Lauren from Speak From the Heart, where I give you all things speech, language, and life. I'm a licensed speech language pathologist, and I'm so happy you are here viewing my newest video. Can y'all believe 2 videos out in 1 month? Who am I? But today's video will be fairly short, but I always feel like some skills that we have to have as speech language pathologists are skills that are learned, not always innately in us, and that's completely okay. One thing that I wanted to demonstrate for you all today is how to explain various medical SLP diagnoses to patients. I feel like patients knowing what's going on, what is going on with their language, what's going on with their swallowing, it gives them the power that they need to be an active role in their care, in their medical care. So I always, when I do evaluations with patients, I end my evaluations by summing up the results of the test, whatever we did, and then I tell them about the diagnosis. I educate them as well as the caregiver if the caregiver is present too. And I also balance this out with handouts, like patient education handouts about different diagnoses. Again, just so they know and they can educate other people in their lives as well. So come along with me. I got my scrubs on this morning. I am wearing my Wear Fix scrubs. I love these because they're super soft, very durable. I've had this for about a year now. So we're gonna set the scene. We're gonna do this together, take notes, practice this. This did not come naturally to me. So one piece of advice before we dive into is to practice doing this in front of a mirror so you can just see what you look like. Make sure you're not like holding a lot of tension in your shoulders, like you look comfortable explaining these things to patients. And also maybe practicing with someone you know, like someone you live with or a friend. Again, just to have these extra practice opportunities, because at least for me, this didn't come naturally. So let's get into it. So what you're saying is, these difficulties are impacting like how you go and order at restaurants and, picking up your medications from the prescription, talking to doctors. I got it. Thank you for sharing that. And so what we call that is aphasia. And aphasia is a term that we use to describe any type of language difficulty that arises from brain injury like a stroke in your case. So what happens is that can impact how you think of words, how you think of words for sentences and in conversation. It can also impact how you understand things, so how you understand what people are saying to you and processing that. And I know that's something that you mentioned can be difficult for you too. So what we'll do here in speech therapy is just try a couple different techniques along with what you've already told me are some of your specific goals. We'll do those together, kind of mesh them together so that we can make some gains for you too. Does that sound good? Perfect. So yeah, I know that you explained that when you're eating and drinking, things are going down the wrong pipe for you, you're having some coughing. And we did your modified, we did that modified barium swallow. That's when you sat and we watched you eat and drink. And so there were some things kind of going into your airway. You had a good cough response though, which is really good. But we call that dysphagia. Dysphagia is a term that we use just to describe any difficulty with swallowing, whether it's like some difficulty with you chewing, some difficulty with things going the wrong way, or things just kind of sitting in your throat, you're having a lot of residue. It's a very general term. And so what we'll do is a couple of exercises together over the next couple of weeks to see if we can get you a little bit stronger so that that's not happening so much for you, so you can go back to eating your neck bones and your pig feet. We'll do that together, and then yeah, we'll go from there. Does that sound like a plan? Perfect. Thank you. So thank you for participating in that testing, Mr. Patient. I really appreciate it. And I know you mentioned that, people are just having a really hard time understanding you. Your speech sounds a bit slurred to you now. Got you. Yes. So we call that dysarthria. Dysarthria. And I can give you a handout about this as well so you can share it with your friends and family. But dysarthria is a term that we use to describe when there's weakness, whether it's in your lips, your tongue, really anywhere in your mouth, when there's weakness there, and that starts to impact how clear your speech is. So if you can think about if the muscles are weak and they're really uncoordinated, they move a little bit slower. And so what happens is your speech starts to sound maybe a little slurred, your voice might be really soft, you might feel like you're a little bit hoarse because those muscles are just moving really slow, a little bit slower than what they're used to. So We'll do some exercises together like I talked about earlier, just to again strengthen those systems for you. Hopefully it makes some improvements in how clear your speech is so you can return to work. Does that sound good? Perfect. Let's get started. I'm gonna face y'all this time. Yes, I can understand. I definitely could see how that could be extremely frustrating. And I'm very hopeful that what we do here in speech therapy will be helpful for you too. So what's going on is a term that we call apraxia of speech. So just to kind of explain this to you, what happens is your brain thinks of a word, dog. I know you have your dog at home. What happens is that pathway from your brain to your mouth gets disrupted, usually from something like a stroke or head injury, a stroke in your case. So what happens is because that pathway is disrupted, what comes out maybe doesn't actually sound like dog. Maybe it sounds like tog. Maybe it sounds like something completely different. So what we're going to do in therapy is work to strengthen that pathway so what your brain thinks of is also what your mouth says. Does that make sense? Yeah. So we're going to work together. We'll, hopefully get you back to being able to say your dog's name and your wife's name, and, those things a little bit easier and more automatically too. Yes, definitely. We'll get started. All right, y'all, thank you so much for watching this video. I hope it was helpful and just trying to think of some of the ways that you would describe some of the more common speech and language disorders we might see in the medical SLP realm. Comment down below. I would love to hear how maybe some of you explain this to your patients. Students, think of like what you would say and comment down below. So I think we can all learn from each other. But make sure you subscribe to my channel. We're growing. Follow me on Instagram at speak.fromtheheart for more SLP content. And I'll see you in the next video. Bye.